I will call the January 27th, 2025 meeting of the Broadwater County Board of Health to order. All right. Is there any public comment on items under the board's jurisdiction and not on the agenda? Is there any public comment? No one's tuning in live. Okay.
Madam Chair, I have a question.
Oh, yes, sir.
I don't know if this is under, we don't really have a spot on here for new business. So if we have a question, do we ask in the public comment or
Yes.
do we?
Yes.
Okay.
I think public
Okay.
comment time is fine.
Just
Or if you want, we can add something at the end if there is any
like new business or
new
something?
business to
Okay.
bring up for the next meeting or to
Okay.
put on the
Okay.
agenda. We
We
can
can do
always
that.
do that. Yeah, perfect. That'll work. I don't have any comments right now. We have discussion, decision, minutes approval. Did everybody have a chance to look through minutes?
Yeah, I read them, but I wasn't here, so I'll let somebody else make a motion.
I read through them. I didn't see any problems. Did you see any? No? Okay. All right. So we have minutes from, we've got October 21st, July 15th, July 1st, June 7th, and May 20th to approve. Is there a motion?
To approve?
We can approve, yeah, we can approve all of them at once.
Okay, yeah, move to approve. Motion to approve, I should say.
Can you state just the dates? Sorry.
Oh, these dates?
Yeah.
Okay,
That
can I
too.
steal
Yep,
that?
yep.
So I motion to approve October 21st, July 15th, July 1st, June 7th, and May 20th of 2024. I went backwards, sorry.
That's okay. I did too. That's okay. Is there a second?
A second.
Great. Okay, there's a motion and a second to approve minutes. We just write this down from October 21st, July 15th, July 1st, June 7th, and May 20th. Is there any public comment? Is there any public comment? Seeing none, all those in favor of approving the minutes, please signify by saying aye.
Aye.
Aye. All opposed? Same sign. All right. They pass. Daleen, I'll give these to you. I think. Do we need to? Just me. Okay, I can sign these after. Okay, that's fine. So we'll have to wait. All right. Okay, we have a bylaws review. Did everyone have a chance to look at bylaws? Yes, okay. Were there any thoughts or comments on the bylaws? I know we had talked about, I have mine right here, sorry. We talked about changing the meeting time. I know under regular meetings, Article 4, it says a regular meeting of the board will be held on the third Monday of every other month at 2 p.m. starting in January. Does 3 p.m. work better? It seems that that time works better for JJ.
Okay.
Did that, because we've rescheduled these to 3 p.m. the past, 3-4 times, I think.
Mm-hmm.
Is that something everyone would be in favor of changing?
Yeah.
Okay. So, I'm going to put 3 p.m. Okay. And then highlighted on here under Article 6 was notice of meetings. It says the administrative assistant shall notify all members of the board of all meetings. Sorry, I'm reading this extra piece. Do we want the chairperson to do that instead of the administrative assistant?
I guess I like the administrative assistant to do it.
You do?
Yeah.
Okay.
I mean, that's just my.
It's helpful, okay. I guess for agendas, I would say, and I think this has been pretty consistent with a lot of our other a lot of our other boards, is the chair will kind of help drive the agenda, put the agenda together, and then work with the administrative assistant to get that out. And the administrative assistant can push it out a little early and say, you know, hey, here's what we have so far. Is there any other items for the agenda? So I just encourage everybody to participate in putting that agenda together. We're pretty lucky right now because we missed the COVID phase, because I think the Board of Health was crazy busy during COVID.
Yeah.
So we're pretty lucky. It's pretty quiet, although I know we have some different things in coordinating with public health and whatnot. So I think that'll just be the plan. I'll try and make sure we have the meeting dates right, meeting dates correct, dates and times, that there's no holidays, because I knew that threw me off too. I'm so sorry. And then I'll, whoever the chair is will work with the admin assistant. I didn't see anything else that I felt like needed changed, except just to update the signature page in the back. Did you have something?
I just had a comment, but that can wait.
You can, you're good.
Well, I just didn't know, because I haven't actually read through the bylaws, so I wasn't sure if in there somewhere we can update contact information for members, January and July? Is that what we discussed?
Oh, I see what you're saying.
Uh-huh.
I don't know if we need that in the bylaws.
Okay.
I think that's something
Okay.
we can just do,
Okay,
just standard, like best practice.
Okay.
Is something. I don't think we necessarily need that in the bylaws. Is that what you're thinking?
that's it.
Okay, perfect. So yeah, we'll have to update this back signature page. So we just have the back signature page and then the change of meeting time. So for whoever is making the motion to approve bylaws with suggested edits.
Motion to approve.
With suggested edits?
Yes, with suggested edits.
Okay.
Was that a motion?
Yes. Yep.
I'll second.
Okay, perfect. All right, there's been a motion and a second to approve the bylaws of the Broadwater County Board of Health. Is there any public comment? Oh, I'm sorry, with suggested edits. Is there any public comment? Any public comment? Okay. Any public comment? Hearing none. All those in favor of approving the bylaws for the Board of Health, please signify by saying aye.
Aye.
All opposed, same sign. Okay, motion passes. Tell JJ he's got his way. Okay, so next on the agenda is discussion decision election of officers. So we have the chair and the vice chair. And the vice chair will serve, will conduct meetings in the case the chair is not present. And then the administrative assistant functions as the secretary, so we don't need to elect a secretary. Are there any nominations for chair?
You want to continue?
It's not a terrible lift. I don't mind. Do you want to own it? No? Are you sure?
Yes. Yes. Yes.
Should we just elect JJ since he's not here?
Well, we could do that too. Well, he's vice chair, I guess, yeah. If you didn't want to do it. But
I don't care. I'm fine. It's fine. It's fine. But you get to make the motion.
well, I'll move that we, let's see, how do I put that? I guess I'll move that we keep Tiffany,
Wrong part of the family. Wrong part of the family.
Lindsay as chair. Well, she's gone too, so we got her.
Right. You second?
Second, sorry.
Okay, it's all right. It's all right. So there's been a motion and a second to keep me, Lindsay Rickmeyer, as the chair of the Board of Health. Is there any public comment? Any public comment? Any public comment? Hearing none, all in favor, please signify by saying aye.
Aye.
Aye. All those opposed, same side. Okay. Look at us getting business done. All right. Next up, we have Ruby Taylor, Director of Public Health. Oh, I'm sorry.
I'm sorry, Madam Chair, do we need to elect a vice chair?
Oh, you know, we should do that. That's a good point. I totally forgot about that. I just had officers on here. Okay. All right. Who would like to be vice chair? Don't everybody volunteer at once, please.
Who is it currently?
JJ.
Is it JJ?
It is.
JJ is vice chair. Do you really not want to be vice chair?
I can do vice chair, just not chair.
Okay.
Yeah.
It's not too bad.
Yeah, no, I could do vice.
Okay, well, I move to nominate Emily Clark as the vice chair of the Board of Health.
I'll second that.
Okay. Perfect. There's a motion and a second to nominate Emily Clark as vice chair. Is there any public comment? Any public comment? Any public comment? Hearing none. All in favor, please signify by saying aye.
Aye.
Aye. All opposed, same sign. Motion passes. Congratulations, Vice Chair. Thank you for reminding me, Vice Chair. I thought it was all about me for a minute. I apologize. Okay, now Ruby Taylor, Director of Public Health, Department update. Come on out. Come on down.
Hello, I'm Ruby Taylor, Director of Public Health. There's not a significant change in public health right now. I'm still working on getting us the board training for Board of Health. The state is revamping that entire program, so we're still figuring out when we can do that. And then still working on my CHA, which is the Community Health Assessment, which I have the data for, and I'm going to go over it with Megan Gillespie this week, I think on Thursday, and then decide if we're taking that as is or if I need to do additional information gathering or what we need to do there. And then if it's good as is and I'm happy with it, then we'll move into the Community Health Improvement Plan process. So it's a lot of work.
Is that the CHIP?
Mm-hmm.
The CHIP, okay.
Most of it has been on Megan's end right now, which has been phenomenal. She's an awesome resource and great to work with. But it's just a lot of sitting around and waiting until we can get things moving. So that's where we are on that front. And that's about it right now. We're just doing immunizations and I need to start looking at bike rodeo for next year, that sort of stuff. Just our regular day-to-day.
Ruby, I get in my email stuff about Board of Health trainings,
Mm-hmm.
and I can't remember who it's from. The Health, is it from the Health Institute, I think?
It might be.
Okay. Is that something I should spend time on, or is it something that's a different, like, higher level?
Wouldn't
Or
be the worst thing because it is a lot of the same, but the Board of Health training with Megan Gillespie at the state is going to be more comprehensive.
Okay.
And it's also, I think part of the moving into a different curriculum is it's going to be online based as well, so that it can be kind of at your own pace and not as time consuming for people. So,
Okay.
but I mean, any Board of Health training is a good idea because not all of us have a lot of experience as Board of Health members. So,
True.
anything you see, not a bad idea to look into.
Is there anything that Board of Health can do to help you? Because it seems like the two obviously are quite interconnected.
Right now, I think I'm okay. The biggest thing that we've got going on is that crisis diversion grant stuff. And that I am just waiting on the task order from the state to get sent over so that we can get that signed into the commission meeting. But other than that, I'm pretty status quo right now. I think that there's more that we could be doing, and I think that the Community Health Improvement Plan will help me kind of get a good idea of what to do in the next 5 years. But right now, we're kind of just hanging out where we are, which is okay.
Okay. Okay. I know there's a relationship there that can be,
Yes, and that's where like the training and that sort of thing is going to help us too, so that we can kind of see what Board of Health can do to help public health and vice versa.
Okay.
So,
yep, that would be great to know as soon as Megan is ready to
Yep.
bring that to us. That would be awesome. Thank you.
no problem.
Right. Megan Bullock, Broadwater County Sanitarian, Department update.
Good afternoon, Madam Chair and members of the board. These are activities from the Environmental Health Department since the last health board meeting. Under the permits issued, I did go ahead and show you what was done in 23 and in 22 to give you a comparison. So the numbers are up from 23 but down from 22, probably a factor of the interest rates mainly. Slowing down of building. Surprisingly, people are still putting in septics. In fact, I had an inspection today and I have a site evaluation still to do, so things are still happening. As far as licensed establishments, I was able to reach the 90% plus that's required under contract with the Department of Public Health and Human Services. And now it's time to start all over again. Temporary food permits, those were from the Christmas stroll. Surveys still coming through weekly, sometimes bi-weekly. And then, of course, subdivision reviews still happening. I am happy to report that as of today, every file from the Trimble GPS has been retrieved.
Awesome. Thank you.
Daleen put together, compiled the second page of what I gave you. She compiled what is still hanging out there. So we estimated I was able to retrieve 120 plus or minus files off the GPS. It was the most tedious task I have ever done in my life, but it's done.
Weren't you drawing them?
Yes.
Like, weren't you pulling them up on the?
It has a screen about that big,
Oh
and I
my
would have to get all the measurements and then redraw on a piece of paper for the file. So it was pretty tedious on a very, very long day. I think the most I could do was about 25.
Oh my gosh. Okay.
I only had a couple really long days. Otherwise, it was just doing them between my tasks. So
Is it obviously helping you pull all those?
it
Missing ones
allows
together
us,
at least.
because there was nothing on file for those files, it helps us stamp those now with a Board of Health stamp, and they're done. They're a complete file. And so that helps our people, because now if they go to sell their house, there's a record of their septic system. There are still a number of this top column Daleen compiled. Those are still ones hanging out there. They weren't on the GPS. There's nothing in the file. I had already gone through them once, and if there was anything, we went ahead and stamped it. I'll go back through them again and see if I can stamp any others. And then we have a list of them that are awaiting the septic installer as-builds. Daleen has been good about reaching out and reminding installers. And speaking of installers, this Friday we have our annual training, and I think we have, how many coming?
I think we have 17, and then a possible 2 more, I think, possibly 5. Just depends on a couple that have said there would be up to 5, but then due to the date, that might change. So they're kind of, and if
That's the
So-
31st, right? Friday?
Friday.
31st,
Yep.
okay.
So a good sizable group of guys that will be here. So if any of you are bored and want to crash course on septics, come join us. I might bring cookies.
What
So
kind of
that's
cookies?
it.
Yeah.
Pardon me?
What kind of cookies?
Last year I did white chocolate and cranberry,
Deciding factor.
chocolate chip. No, I've not shared my recipe with her.
Okay.
Okay. If there's anything in particular that I'm not reporting on that you guys want to know about? When you just look at this in a glance, you think, wow, we haven't been too busy, but trust me, I think it's been fairly busy. Lots of questions coming in, people stopping in. So if there's anything else that you guys are interested in us compiling data for, let us know.
Okay. Thank you. I think I'll ask you that offline. It's not pertinent right now. But anyway, it's just the septic permits made me think of it. But yeah, thank you.
I think, don't let me forget, I think my contract's up pretty quick, so we'll need to.
That's unacceptable. Completely unacceptable.
Other than that, it's been busy. Now that GPS is done, that'll let me start doing food inspections again, so.
Well, nice job on getting these things done.
Yeah, thank
That
you.
would be-
Thank you, it was painful.
Yeah.
Thank you. And thank you to you too, because I know you
Yeah,
guys have both
yeah,
worked
yeah,
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 Danae's
absolutely.
done a lot.
exceedingly hard. Yeah.
Lots. Are there any questions?
Thank you.
None?
Thank you
Okay.
for everything you contribute.
You bet.
So very helpful. All right. That was our last order of business. I'll ask for any other announcements or any new business that might be brought up right now, if anyone has anything.
Well, Madam Chair, I have a question, or maybe a question, I guess, for Ruby. I was reading in the notes where you met with Dr. Campbell. Or did you meet with Dr. Campbell about continuing?
We've talked about it in the respect of like succession planning in general,
Yeah.
because we don't have a succession plan,
Yeah.
which is a problem. So if something were to happen to myself or Doc or what have you, like we've got
Nothing.
nothing
Yeah.
set up. And specifically with Doc, if he were to pass in Montana, you can no longer use those orders. So that means I wouldn't be able to give vaccines until I found a new medical director. So it's been something that's been on my mind, and I've been working to figure out how to remedy for the entirety of my time as the director. And it's more of a convoluted and time-consuming process than was really thinking it was going to be. But I think the path that we should take is getting an MOU with the hospital to use one of their providers in the instance that Doc has something come up or passes away or anything like that. Just so that we have a coverage. And then we've also, I know the commission has been looking at like the contract for Doc to be health officer and director of public health or medical director of public health. I cannot find anything in my...
They don't have anything either, so there's no contract.
Yes,
It's just,
so-
and I think that's probably understandable. It's been kind of that way for a
Yeah.
long time.
Mhm. And so we also need to look at that and kind of get a game plan going for that too, because truly we shouldn't not have that in writing somewhere. But I am happy with Doc. He is super helpful when I need him, signs my standing orders, and has never caused me any guff. So
Okay.
I enjoy Doc.
Yeah.
He can be a little gruff sometimes, but I'm just as gruff, so it works out.
We did take that to med staff.
Okay.
I will follow up on it. We have another med staff meeting, I believe, in February.
I need to get you a job
That would be
description, which I
awesome.
don't know that we have, but I can pull
That'd be-
other counties to
That'd
see
be
what theirs
great.
are.
Yeah, because then I can take that back to med staff in February. So,
Yeah.
Can you bring, that would be awesome.
Yeah.
Could you bring that to our March
March one?
meeting?
Mhm.
Yeah,
Yeah,
that would be
just to
great.
see
You can.
what that would look like if anyone would be interested outside of.
Yeah.
What an MOU, what would be
Yeah.
required for an MOU, because everybody's a little different.
Yeah, that's
Mhm.
what I think Justin was looking into.
Okay.
Yeah.
And they were interested with the job description or what,
Yeah.
you know what I mean, whatever there is to look at. So,
Mhm.
yeah.
Perfect,
definitely.
thank you.
Well, I think that'd be great.
Yeah.
It's just, like you say, we don't really have any plan B at all.
No, and
Mhm.
it's the same for myself. Like if something happened to me, they wouldn't know how to do any of the grant stuff
Yeah.
over there. Like it's the way that the department has been run for a long time, and it's hard to get out of that habit. So that is ultimately one of my goals. Like I would just like Like if I disappear, public health can run just fine. If something happens to Doc, or he quits, or he decides to retire, public health will be able to keep their bearings and keep doing what we do. So that is my ultimate game plan, but it's slow goings. Forget about all the political nonsense.
Well, it's
Yeah.
hard. It's hard when you're trying to work
Uh-huh.
to train, and you are running on a minimal
Mhm.
staff as well. So,
And I'm
Well,
still
okay.
figuring stuff out my own self because I had no public health background when I started in
Yeah.
public health and had a year to work in it, and now I'm in charge of it. It's a good time.
Oh, Madam Chair, it's the job description, he doesn't have a contract, but there is a job description for medical director. Isn't there a requirement that they attend so many meetings or? The reason I bring this up is because I think we need to have somebody that's interested, leadership to kind of guide the board, one, and,
I believe that the requirement is that they come to at least one, because like our bylaws state that we meet every other month, and so I think it was one meeting a quarter, if I'm not mistaken.
yeah, I remember reading it, but I don't remember what the details of it.
And I don't know if that was in our bylaws or in an actual description
Yeah,
of the position.
well, you're right, Doc has been doing it for, umpteen million years, and,
Yeah, and
but if something was to happen, it'd be nice to have some,
no, and he was a huge support during COVID and stuff like that, so it's not like he doesn't step up when he,
yeah.
it's just, he's a busy dude, gets confused about meeting days, me too. So, it just kind of happens. But this particular time, he had every intention of coming, and then his brother passed away, so that's
Oh, really?
unfortunate.
No, I didn't know
Mhm.
that.
Yeah.
Oh, shoot.
are you communicating with him about meeting times and stuff? It was a little bit crazy, and again, I apologize. We
Yes.
kind of went back and forth on dates this last go round.
Yes, and that was the biggest issue with this time around, is that we went back and forth so many times. But I will contact him if I need to, but Daleen also has his email and emails
Okay.
him, and he gets those. I think he just, when the chain kept going back and forth, he got a little lost in that.
Yeah,
And so
understood.
he's
It
like,
was-
what day is it? So we figured it out. He knew it was today. He just couldn't make it due to
Yeah.
family situation.
Yeah. Oh, I didn't know that. That's understandable.
Our bylaws say that the duties of the health officer shall be those as stated on 50-2-118 in MCA.
Okay.
So I'll review those and make sure we're lined out, and maybe that's something as we move forward, we can kind of talk about
Yeah.
next
Yeah, okay.
next meeting. I'm curious though too, does St. Pete's have any interest in an MOU?
I don't know that for sure right now.
Okay.
Yeah,
I think that would be harder than getting it with Billings Clinic, because even though they run under main campus, our hospital still has quite a bit of autonomy here.
Mm-hmm.
And the St. Peter's Clinic does not necessarily have that autonomy, so it would have to go through St.
The whole-
Peter's
Yeah.
whole conglomerate situation. And
yeah, that was my thought too.
Uh-huh.
Yeah.
Okay.
Open it.
So we want to see where we can go with this clinic. and,
yeah,
Okay. Okay.
And having the multiple providers there too might make it easier
Mhm.
just to kind of keep the concurrency going.
Definitely.
Well, pass on to Doc that we're sorry about all the crazy emails and holidays. This whole holiday season was bizarre, the way the days laid out.
yeah.
It was just weird, and I feel like it threw everybody off. But then we had all our IT stuff updated, and it was just
Yeah, the last
and a
couple
new
months have been a
website.
dumpster fire.
Yeah.
That's no one's fault.
There we go. And Ruby will sum that up for us.
In summation, dumpster fire.
All right. Does anyone have anything else they would like to add before we adjourn? Daily? Oh, sorry.
That was it.
Oh, that was.
Yeah.
Okay.
Thanks.
Daily?
I did bring a public sign-in sheet,
Okay.
and so that when we have guests, then we could have them sign in, so I can have proper spelling of names
Perfect.
for the minutes. That'd be great.
Will you all remind me, because and maybe after chairing the commission as well, I'll be in the habit of doing that, but I tend to forget,
Okay.
so that'd be great. Thank you. All right, if there's nothing else, we will adjourn our meeting, 3:30, like on the